Hi, this video is the art of hair transplant restoration surgery on an African American man who has a receding hairline and receding corner, and he actually did it from the front to the back. If you look all the way down for me, all the way down, you can see he's thinning toward the back here too. So our goal is to not only lower the hairline, recreate the hairline, but build toward the middle as much as we can, and try to give him so much. We establish the frontal because he'll be losing all these hair as well. So when we do the surgery, we're not only just doing for the now, we'll cover this for me, and then, but we want to make sure for the future as well. Hair transplant, as you know, it's an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. And especially for black hairline, it's different than other ethnicity. And as you know, I'm one of the very few hair transplant surgeons who specialize in the art of restoring hair, especially hairline for black African American men. And we'll be attempting around 2,000 grafts on this client using the FUE method. I'm not only specialized in the FUE, but I'm specialized in FUE for black client. Why it's so difficult is not only the hair is curly, but the root is curly. So where the hair exits, the root could lie to left, right, or any position. And so it's very difficult to do the FUE. You know, when the surgeon who not specialized on FUE, but want to continue to, so then what they do, they buy the two different machines, the neograph and the robotic. The neograph, the surgeon doesn't really operate on you. They just say hi and bye. But when they come to do operation, then the technician does everything. So the surgeon doesn't touch you with the neograph most of the case. So imagine they design your hairline, that could be ruining your look. And then the robotics or the artists, well, you know, they cannot be able to do mimic what, you know, we can do. The transaction rate is pretty high too. So with my work, I'm the one who does most of the work. I will be the one designing your hairline, and that's very important. And I'll be the one who pulling one root at a time, and I'll be the one who make the site and all the stuff. We will have the whole team to help me, but you know, I will do most of the work. Now, on average, from the mid eyebrow to the hairline for African American men is 6.5 to 7. African American men, Asian men are similar in terms of height. And then from the midpoint to the temple, as you can see, he has a little bit receding and pointing toward backward. And so from the midpoint to the temple, we can go from 7 to 8.5 centimeter. So for this client, we actually brought up to 7.5 centimeter. And from the midpoint to this temple is 7.5. So we do this to make it very evenly out, so that way it will look more natural. You don't want one to be uneven or one side further back. In actuality, this temple has received further back than this temple. So this is where the temple began, but his is gone backward. So this is where the hairline. Once we get the shape down, we will transplant at a very precise angle, flat 15 degree, and slightly change when we go backward. The angle is important, the selection of hair graft important. We transplant rows and rows, single hair graft in front, followed by root number 2 hair, 3 hair, and 4 hair in the back for bulk and volume. The other important factor is the zigzag for Asian and Caucasians, 35-45. For African Americans, a smaller zigzag. Why? Because we're going to line the hair graft anyway, the hairline, so smaller zigzag. This is the art of hair transplant on a client with receding hairline corner. Thank you.